wrong results there. Even during labor and delivery now, when one of the watching vital signs, right? If after birth the woman actually shows with signs of possible alright, that's very good. So what you have to do is that immediately you have to check the uterus for firmness and position. Is that okay? Because if you check the uterus and it is relaxed, it's telling you that maybe there is uterine atony. Is that okay? Means the uterus is not contract. That means on vaginal examination, what you first touch is actually the bra. This is on vaginal examination. It means that the baby is actually presenting with a bra presentation. And if on a vaginal examination you touch the occiput, where is the occiput found? Here, right? You touch what people call back head. You touch the occiput, right? It means the baby is presenting in which position? The vertex presentation, which is actually the best presentation suitable for childbirth. You will know. It is very round. It is round, right? And when you touch the sutures around, right, you actually feel it. It's surrounded by sutures. When you touch it, you will know. There are landmarks now that will detect, because immediately you touch, let's say if I touch this particular area, I will know that it's this area. Is that okay? And at times, with a face presentation, right, you touch the chin, it's either you touch the chin, your hand will even enter the baby's mouth and they start sucking. Yes. Touch, yes. You can even touch even the nostrils here. And please, the face presentation, right, is actually the longest presentation. It causes obstructed level because the diameter of the fetal head, right, is too long. It's around 13.5 centimeters, which is longer than what the maternal pelvic inlet. So it cannot pass through. It means that it is extended like that, and it will not pass through the maternal pelvic. But now for the vertex presentation, what happens? The baby's head is actually well flexed. Flex means it actually comes, the chin, right, comes in contact with the chest, and the baby is just there like that. And with that type of diameter, it's around 11 centimeters diameter, which is mostly suitable for childbirth. Did you understand? Yes. So the correct answer there is actually a passive movement of the unengaged fetus, which is B.
After 4 hours of active labor, the nurse notes that the conjunction of the pregravial glands are not strong enough to dilate the cells. Which of the following will the nurse anticipate doing? A. Obtaining an order to begin IV oxytocin infusion. B. Administering a light sedative to allow the patient to rest for several hours. C. Preparing for the cesarean session for cesarean session to progress. D. Increasing the encouragement to the patient when pushing.
What will you do? You put oxytocin. Is that okay? Because you need to obtain an order to begin IV oxytocin infusion. Is that okay? And we know what's one of the functions of oxytocin. It actually strengthens uterine contraction. Is that okay? And help in what? Progress in cervical dilatation. Yes. So the first thing you anticipate to do is to obtain permission and start or begin oxytocin infusion. You cannot give sedatives to the woman now. means you want the woman to just be sleeping. And
B. In the lower left maternal abdomen. B. In the lower left maternal abdominal quadrant. C. In the lower right maternal abdominal quadrant. D. Above the maternal umbilicus and to the left of the implant.
you know that during physical examination, right, when you locate the back of the fetus, that's where you are going to place what? Your Doppler or your fetoscope now. Those are the instruments you use now to listen to fetal heart rate. Let's just say this is the abdomen, right? The patient says that the fetus is in which position?
The left anterior breech.
Let's use this. Let's the woman is standing or lying down like this, right? This is actually the right, and this is the left. Here is the right, and here is the left. You see the left
Anterior.
the left anterior. Anterior means in front. It means the baby is facing what? The front part. Is that okay? Yes. Did they say bridge?
Breech position.
Bridge position. What's the bridge position? Bridge presentation. The lower limbs, not only with the bottom. Is that okay? There are times that the baby will just send the legs, one leg like that during delivery, and you have to do what? To look for the other leg to pull out. Is that okay? Yes. So the baby is actually in the left. Let's just say this is actually our fetus here. This is our fetus here, right? Now, where will you get the fetal heart rate? If you want to take the fetal heart rate, you said the baby is facing in front. Where will you get the fetal heart rate? Yes. You get it
Around where the back, that back. Where the baby back.
yes. So you are going to get the fetal heart rate at where? Above the maternal umbilicus. Above the maternal umbilicus. Is that okay? The D. Above the maternal umbilicus and to the left of the midline. The left of the midline. That means you'll be placing your fetoscope around this area. Is that okay? To get the fetal heart rate. Now our baby is so low. And I hear that children born with this bridge presentation, they are very stubborn.
Question 14. A patient is in labor and has just been told she has a breech presentation. The nurse should be particularly alert for which of the following? A. Picnic. B. Ophthalmia neonatorum. C. Pica. D. Prolapse umbilical cord.
You tell a woman that she has got a breech presentation. The woman is at risk of which of these complications? What is quickening? It's not the first movement. The first movement of the fetus fell by the mother. You must have felt. And the first movement of the fetus fell by the mother. And what is ophthalmia neonatorum? It's still what you call conjunctivitis. Is that okay? Yes. Then what's pica? Eating disorder. What happens? That's very good. Okay, that's very good. So you are just craving non-food substances. Is that okay? It mostly happens during pregnancy. Yes, those are one of the signs and symptoms of pregnancy. You crave non-food substances. Examples, you can actually crave for chop. You eat chop. Is that okay? You eat clay, charcoal, mud. Some of you want to eat even lions, but they are eatable. There was cod prolapse.
When the cord comes before the presenting part of the
Alright, that's very good. So when we talk about cod prolapse, right? It is actually when the presenting part, when the cord presents itself in front of the presenting part when membranes have already been ruptured. So, okay. So the possible answer there is actually cord prolapse. You know that the breech presentation, it means the baby is actually coming out with what? The legs. So most of the time the cord can easily slips out. Because it's not like the head will just occupy that particular the particular pelvic cavity. Is that okay? But with the lower limbs, imagine the baby sends out one leg before you during childbirth you are struggling to move the other leg. So the woman is at risk of cord prolapse.
Next question. When teaching a group of adolescents about variations in the length of the menstrual cycle, the nurse understands that the underlying mechanism is due to variations in which of the following phases? A. The menstrual phase, B. The proliferative phase, C. Secondary phase, D. Ischemic phase.
Yes. When you are teaching a group of adolescents, when they say variation, it means this one you can actually have a cycle of 28 days. The next one you have a cycle of 30 days. The next one you have a cycle of 27 days. What happens? Which phase actually changes the menstrual cycle? Which of the phase here changes the menstrual cycle? No, the menstrual phase is actually constant. It is constant. What actually, you know that what happens during the menstrual phase? That means the endometrial lining sheds. Is that okay? And you know that with the proliferative phase, another name for this proliferative phase is another name for the proliferative phase. There are 4 main phases of the menstrual cycle, and you should list them accordingly. Accordingly, that I'm asking that what's another name for the proliferating phase? And you should give me the menstrual cycle in order. The menstrual cycle starts with which phase? Ovulatory. Now, the first phase that starts the menstrual cycle, right, is actually what we call the menstrual phase. The menstrual phase. phase, you go down to what? The proliferative or the follicular phase. The follicular phase. From here, you go to where? The ovulatory phase. The ovulatory phase. And from the ovulatory phase, you go to where? The luteal phase. The luteal phase. Now, what happens during the menstrual phase? Alright, now during the menstrual phase, right, since the levels of estrogen and progesterone have dropped, right, it will actually cause what? Shedding of the endometrial lining. Because what was actually keeping those, or what was keeping the endometrial lining to still be standing or waiting for a possible implantation, right? It was thanks to the hormone estrogen and progesterone. Now, during the menstrual cycle, what happens? When their levels drop, it causes what? The endometrial lining to actually shed off, coming out as what? Menses. What are some of the signs and symptoms during the menstrual cycle? Yes, we have abdominal cramp. That's already menses. There's nausea and vomiting. Not high temperature. Loss of appetite. There's just a slight increase in the temperature, not high temperature. Okay. Yes, we have loss of appetite, anorexia, right? What do you mean? What do you mean? Yes, there's fatigue. There is fatigue. There's lower back pain now. There's lower back pain. It's as if they are cutting your waist. It's as if they are cutting your waist. And you need to know the average length of the menstrual cycle is actually, the menstrual phase is 3 to 7 days. That's the average length. And they vary among individuals. Is that okay? It means when we say the average length, it means the woman can menstruate within this period. Like the average, that is normal. Yeah. It is normal. It becomes abnormal when it is too heavy. When the menses is heavy, right? What do they call heavy menses? Medical term. Heavy menstruation. Menorrhagia is menorrhagia. And what is metrorrhagia? You cannot tell me no. What's metrorrhagia? Bleeding between regular menstrual cycle. When you bleed between your regular menstrual cycle, we call it metrorrhagia. Metro. What the metro will jump? Metrorrhagia. Then we also have menorrhagia. Yeah. Lining to be building up, preparing the endometrial wall for a possible implantation. Is that okay? So during the follicular phase, it's just like maturation of the Graafian follicle. Are we there? I need to know that they overlap. Now, as estrogen levels rises, right, towards ovulation, before the woman actually enters ovulation, right? As estrogen levels actually increases, it actually causes what? The release of which hormone? The luteinizing hormone. Please, the luteinizing hormone is the hormone that starts what? Ovulation. So if the woman does not produce the luteinizing hormone, ovulation will not actually start in that woman. So the levels of estrogen will trigger the release of the luteinizing hormone, which will start what? Ovulation. When we talk of ovulation, what happens during the ovulatory phase? It means the mature ovum, right? The mature ovum is actually what? Released into the fallopian tubes now, and it's traveling down this. Are you changing your word? Alright, you have sharp things. Now, let's say the ovary that actually releases that hormone, right? So the woman tends to have these sharp things that are very discomfort. At times, even to even stand up straight like that, there is no way because of these sharp things, as the ovum is actually traveling down the fallopian tube. Then we also have the discharge. It's not any type of discharge. You know that the vagina has normal vaginal discharges now. How do we call them? Normal vaginal discharges, how do we call them? What? Okay, they should talk. The people should talk. We call them leukorrhea. The normal vaginal discharge that we have, we call them leukorrhea. Now this ovulatory discharge, right? It actually looks like an egg white. You know how an egg white is, right? I don't know if you know an egg white now. Yes, it looks like an egg white. Then it is stretchy. Is that okay? It is stretchy, a bit whitish and clear, right? That's how it looks like. And it is odorless. So if you're always having odor, you have to go to the hospital. It means it is infected. Are we there? Yes. Yes, you see it comes out. You have to touch and you smell it. And it's very thick. Yes. Yes. Is that all? Are those all the signs and symptoms of ovulation? We have breast tenderness and enlarged. The breast increases in size a little bit. They are tender and a bit painful. Is that okay? And yes, we also have breast tenderness. Even in the luteal phase, you have breast tenderness. Is that okay? The breasts are a bit tender and they are enlarged a bit. Is that okay? And they are a bit painful. And they are a bit painful. What happens again? And
Manage to that increased desire for sex.
yes.
The answer is correct.
It's correct. You are medical students. You shouldn't be shy of this thing.
I'm not sure. It's not to me answer.
Alright. Now, during your ovulatory phase, right, the woman tends to have this high libido. Is that okay? There is high libido. It means like she has this increased feeling of having sex. Is that okay? It's because of the high levels of what? Estrogen and progesterone. That is why the woman will have this increased libido of having sex. And you know that the ovulatory phase is actually the only phase during the menstrual cycle that the woman gets pregnant. Is that okay? After your ovulation, you cannot get pregnant. Yes. Now you go for. Alright, is that all? Okay, if that's all, let's continue. Now, what happens during the luteal phase? What happens in the luteal phase? It is also known as the secretory phase. Okay. The luteal phase is also known as the secretory phase. What happens there? Now, during this time, right, the corpus luteum is formed. In the luteal phase, the corpus luteum is formed. And now, when the corpus luteum is formed, it actually produces what? The corpus luteum produces the hormone progesterone. Is that okay? That helps to maintain the uterine lining. And then the uterus also becomes ready for what? A possible implantation. Are we there? The uterus is preparing itself for a possible implantation. Now, if fertilization did not occur, what happened? The level of these hormones will actually drop. Are we there? And when they drop, what happens? It starts another cycle. Are we there? When they drop, it starts another cycle. Alright. So is it okay? And are we okay with the menstrual cycle? Alright. It's special. It's actually the proliferative phase, which is the follicular phase. Alright, yes.
Next question. A premigorial patient is admitted to the labor delivery area. Assessment reveals that she is in early part of the first stage of labor. Her pain is likely to be the most intense. Her pain is likely to be most intense at around the pelvic girdle, B, around the pelvic girdle in the upper arm, C, around the pelvic girdle and at the perineum, D, at the perineum.
Yes, where will she be feeling the pain? In early labor, where will she be feeling the pain? Around the pelvic girdles now. And now, during the early phase of labor, right, the woman can feel pains where? The pelvic girdles, which other side? The back, that's good. And where? The lower abdomen. Is that okay? Now, when the woman is, let's say, in the last stage of labor, the last phase of labor, she can feel the perineal pain, where she's actually having this urge to push. Is that okay? Yes. But when she's still in the early stages of labor, she feels pains around her pelvic girdles. People know the stages of labor. And yes, people should give me. Yes, what happens in stage 1? Yes. Yes. Postpartum. Okay. And you also know that in stage 1, which is cervical dilatation, right? It is divided into how many phases? Two phases. Alright. Now, according to some school of thought, right, it is divided into 3 phases. And according to some, it is divided through where? Through this pelvic index. Is that okay? So most of the times, it will actually cause what? The head or the fetus bones will want to maybe overlap, right? To actually force like the head to pass through the bony pelvic. And in those cases, you mostly or you will likely see what we call severe molding. That way will be severe molding. So it will, for the nurse to actually confirm the type of molding, right, she will definitely be looking at fetal body flexion and extension. So the correct answer there is A. Yes. There are types of molding. There's mild, there's moderate, and there's severe. You never knew. There are types of molding. Yes. The next question.
Question number 20. The nurse in charge is reviewing the patient's prenatal history. Which finding indicates genetic risk factors? A. The patient is 25 years old. B. The patient has a child with cystic fibrosis. C. The patient was exposed to rubella at 36 weeks gestation. D. The patient has a history of preterm labor at 32 weeks gestation.
Yes. Genetics. What's the correct answer there? Cystic fibrosis. What is cystic fibrosis? Yes, it's actually a genetic condition where the organs or mucus, they actually secrete mucus which actually blocks organs and actually the respiratory system. Is that okay? Not it blocks like any organ that produces mucus. Is that okay? It actually blocks it. Yes, that's cystic fibrosis. It is actually inherited. Most of the times they do surgery to remove the mucus now. Every time they remove it. Sister. But there are drugs to reduce the secretion of mucus. Is that okay? Yes, there are also drugs that are given to reduce the secretion of the mucus. I think we are going to section B, right? Yes, what's the first question?
Define the following. Referral infection.
What's puerperal infection?
Infection after, before.
Yes, what's puerperal infection? Puerperal.
Infection that occurs after childbirth, the temperature of 38 degrees.
Yes, that's good. Alright, so when we talk about puerperal infections, right? Puerperal infection is actually an infection of what? The genital tract. You have to put the genital tract. Because when you just say infection, you don't know where the infection is actually affecting. Is that okay? It is infection of the genital tract occurring after childbirth or after an abortion, usually within the first 42 days postpartum. 42 days is equivalent to 6 weeks postpartum. Occurring after childbirth or after an abortion, usually within the first 42 days postpartum. Yes, what's the next one? I need to know that this infection commonly affects which organs? Name the parts now. Yes, we have. It commonly affects the uterus, the cervix, the vagina, the perineum. It commonly affects the uterus, the vagina, the perineum, and the cervix. Within the first 42 weeks, 42 days, sorry. Within the first 42 days postpartum. That 42 days is equivalent to 6 weeks. Is that okay? And these infections are usually caused by bacteria. Is that okay? They are mostly caused by bacteria. People should give me some of the signs and the symptoms. A fever of greater than 38 degrees and above. Is that okay? Yes. Once again. Yes, there's lower abdominal pains. Foul smelling lochia. Yes, there's foul smelling lochia. There is also chill. People know chill now. Yes.